are live at the 20th Inaugural Lecture for the 2023-2024 academic session. My name is Deborah Akumola Fejoy, and this lecture was delivered by Professor Amam Chinyere Mbakwem, and it was titled "It's Your Heart, Guard It with All Diligence, Every Heartbeat Counts." This lecture was insightful, captivating, and enlightening, and the prof delivered it with such eloquence and such knowledge that everybody had to listen. So what I took away from this lecture was that you have to diagnose heart failure early so that you can treat it and the cost doesn't burden you out. Thank you so much for listening.
I welcome you all to the 20th Inaugural Lecture of the University in the 2023-2024 academic session, titled, "It's Your Heart, Guard It with All Diligence, Every Heartbeat Counts." Our inaugural lecturer is Professor Amam Chinyere Mbakwem, the current head of Department of Medicine, Faculty of Clinical Sciences.
So we are here with the prof herself. So Ma, you just delivered a great lecture. So my first question would be, how do you see the medical field evolving in the next decade?
Well, it depends on what we do with it. If the government is ready to invest properly in medicine, because the new discoveries, new things are happening at a galloping rate. So we can't be doing things like we did it yesterday. We have to do new things, and we have to invest in medical care. You saw the figures I was reeling out. Outcome is very poor, and some of these patients can't afford their medications. They can't access hospital, and except the government comes in to help, it's a tall order.
Absolutely, I absolutely have to agree. So my next question is, you just delivered the speech. How do you feel currently? And how do you think this inaugural lecture is significant for the medical field?
Well, I've just showcased what I've done over the decades. An aspect of it, heart failure, and shown people, like the slide I showed, that heart failure kills more people than cancers. But when we say cancer, everybody is afraid. But when we say heart failure, like I said, when we say heart failure, they're telling me, I'm still walking around, I'm still going up and down. How could my heart have failed? So those are issues we have to grapple with. But heart failure is a serious disease. 50% of our patients will die within 5 years. So it's a problem. It is a problem.
I totally agree. So my last question is, what message would you like to leave with the audience today?
Look after your heart. Watch what you eat. Like I said, like the Bible says, guard your heart with all diligence. Out of it are the issues of life. Watch what you eat. Watch what you smoke. Watch what you drink. What you inhale. Because the heart failure doesn't just happen. It's risk factors that are not properly managed that damages the heart, and that the heart can no longer function. And we're talking about heart failure.
Yes, you should watch what you eat. Thank you so much, Prof. Have a great day. Thank you.
Our inaugural lecturer has been a resource person at update courses of the West African College of Physicians and the National Postgraduate Medical College. She has served as an examiner for the West African College of Physicians for the last 11 years, and external examiner to the University of Benin, University of Nigeria Nsukka, Obafemi Awolowo University, Ile-Ife, and Lagos State University. She has also assessed candidates for professorial chairs for the University of Nigeria Nsukka, Ilorin, Alex Ekweme Federal University, Ndufu Alike Ikwo, Ebonyi State, and Lagos State University, and the University of Port Harcourt. Professor Mbakwem is a member of many local and international professional bodies, including the Nigerian Cardiac Society, the Nigerian Hypertension Society, Pan-African Society of Cardiology, PASCA, the African Heart Rhythm Association, the European Society of Cardiology, the American College of Cardiology, and the European Heart Failure Association, as well as the Atrial Fibrillation Screening Association.
I'm eternally grateful to God who has made this day possible. Thank you, Madam Vice Chancellor, your management team, and the University Council for giving me the opportunity to deliver this lecture. I thank my family for their support, encouragement, and being my most dedicated cheerleaders. I thank my late parents for their belief in me, even when I thought I did not have it in me to become what I am today. I am really a manifestation of the words in the book of Proverbs 19:21, which says, "Many are the plans in a man's heart, but only the counsel of the Lord will stand." They said to me, okay, why don't you work hard? You know, medicine is competitive. If the registrar hears this, they'll give up your space. Why don't you work hard, get a good GPA, and then we can change course in second year. In working hard, I got the best results in my first year. I made the dean's list. I got a university scholarship. The rest is history. I had entered residency with a mindset to do dermatology because I had lofty business ideas. I wasn't going to be running around the world. I was going to set up a clinic and a cosmetic shop, a big cosmetic shop next to the clinic. Thank God for beautiful skin. So if you ask me my routine, I'll direct you to the shop. But, Madam Vice Chancellor, it was a frustrating time. A patient comes in and all I see is a rash. Prof. Olumide, doing of dermatology, passionate about everything on the skin, says, "This is a papulosquamous lesion. Can't you see the silvery scales? Arrange the mosaic pattern." Madam Vice Chancellor, I will look, and all I see is a rash. The title of this inaugural lecture, "It's Your Heart. Guard it with all diligence. Every heartbeat counts," reflects both my passion and the stark reality I face daily in my line of work. Proverbs 4:23 says, "Keep your heart with all diligence, for out of it spring the issues of life." Madam Vice Chancellor, this is true both spiritually and physically. Your thoughts, emotions, belief system will affect who you become, your personality traits, and your character traits. Also what you eat, what you drink, what you smoke, what you inhale, your lifestyle will affect your heart either positively or negatively. It can affect the muscles leading to pump failure. It can affect the arteries and they get clogged up and blood supply is cut off. It can also affect the electrical system, and we talk about arrhythmias. Journey a few years ago as junior residents, and here you are, you have become specialists, you become gurus in your own subspecialties. Well done. And to all the young cardiologists who have become faculty members, Dr. Amadi, thank you for all the support. Dr. Olusegun Joseph and Dr. Kushimo, I know I must have stretched you a bit, but it's all for the good of the patient. To my numerous mentees, thank you. You give me hassles, and I also give you hassles. But at the end of it all, we come out shining. The planning committee, Dr. Amadi, Dr. Bieli, leading the pack, thank you so much for the work done. Madam Vice Chancellor, I would like to appreciate the staff of MEDU because they were quite helpful in the birthing of the Spices curriculum. We graduated our first set of the Spices curriculum this year in March. To my numerous collaborators, locally, Prof. Okia, Julichukwu, the rest from around Nigeria and on the international scene, thank you for working with me. A big thank you to my patients who consented to participate in my research despite the inconveniences. Your contribution to this journey and the improvement in knowledge that is reshaping patient care is unquantifiable. To my students, some of whom have become lecturers, associates, senior lecturers and associate professors, well done. To the men and women of God who stood there for me, spiritual support, Pastor Adiola Mensah, Reverend Titi Mensah, Pastor Shola Balogu, Pastor Rotimi, Pastor Deji. Thank you so much for all the support. My special friends, Pastor Ese and Rekia, thank you for all the support and all the trouble you give me in church. And to my Sunday school group and workers in the educational directorate, thank you for making the work of ministry easy. To my family, you are the best I could ever be, I could ever hope for. To my late parents, thank you for setting me up on this path. Papa, I'm sure you are watching from heaven, but would have been the proudest parent if you were alive. You were always my greatest cheerleader, despite the hassles I gave you as a very stubborn child. In my early days, yes, I gave the man hassles. Your guidance and the grace of God is what has made this day possible. To my siblings, Phyllis Akogo, Ihoma, Ibariani, the fights, the wranglings, the makeup afterwards, the support, the counsel, whether sought for or unsought for, that you offer. Thank you. A big thank you to all my cousins, my nieces, my nephews, all my in-laws. Thank you for being there for me and for all the support you gave. God bless you all, and thank you for coming.
So, is there anything that you have learned from this particular lecture that you would want others to also take along?
Especially in the area of communication. Just apart from the clinical aspect, she took it beyond just clinical. How to train students and other people in how to communicate with our patient, because usually you find out that the patient and the doctor, sometimes we are not on the same page. So she actually focused on that, and that actually, from what we saw, actually gave a better outcome of the practice. So I think I really like that aspect of introducing communication. And not only that, she went out of her way to set up structure, to be able to foster that and encourage that.
Absolutely. I absolutely agree with that. So if you were to describe Prof in 3 words, what words would those be?
Well, Professor Mbakwem, I've known, she was, and she's still one of my trainers. Okay, I'm one of her mentees. She's very passionate about what she does about heart diseases. She's a scholar, a mentor, and a profound academician. That's Professor Mbakwem for me.
Nice. So my last question would be, why do you think this inaugural lecture is necessary for the medical field?
Okay, so this inaugural lecture, in particular, is important to communicate what we see in cardiology, beyond the hospital to the general populace, and even beyond to the common man on the street. That heart is very, very important. She emphasized the role of the heart, the most hardworking organ in the body. She mentioned that, and that every heartbeat counts. So if we take care of our heart, like she said, we are inadvertently taking care of all the other body parts. She mentioned when the heart comes down, it drags down all the other things. So all the risk factor, the hypertension, anything that can potentially lead to heart failure, you want to stay away from it. So very, very important.
So first, can we get to know you? What's your name, sir?
I'm Dr. Lauren Toba. I'm the general manager CIS for Get Pharma. I come actually because of Professor Mbakwem for the inaugural lecture. I think Professor Mbakwem has done a lot in the area of cardiologists, and both locally and internationally. And today is a great day for her. And I think sons and daughters everywhere, not only in the medical profession, have actually come to say a big thanks to what he has been doing in the area of health sector. I think that's why I'm here as well.
So my question is there anything you would like to say to the professor on this special occasion?
Oh, to say to this great woman a job well done. And she's just starting. And I think sky cannot be the limit of this great professor.
Thank you, sir. Have a great day, sir. Thank you. First, let's get to know you. What's your name, please?
My name is Dr. Anayo Stella Maris. I am currently a house officer in Lagos University Teaching Hospital, Department of Internal Medicine, Hematology and Oncology Unit, to be precise.
Nice, nice. So my first question would be, if you were to describe Professor in 3 words, what would they be?
She's beautiful, she's intelligent, and she's a power woman. I learned a lot today.
Absolutely amazing. So is there anything you would like to share with the audience from what you gained from this particular lecture today?
Okay, yes, we were enlightened thoroughly on the burden of heart failure and how it affects a diverse group of people, and most especially pregnant women, who are very, very important for our society. And it was really eye-opening, because a lot of us did not have that knowledge before now, and we did not know that it was that big of a deal till this current lecture that we just had. And I learned a lot, and at least now we know that there's a guideline for non-cardiologists and for obstetricians to go through to know the proper way to manage these women.
Nice. So my last and final question would be, how do you see the medical field evolving in a decade?
There is room for a lot of growth, especially with the whole introduction of technology into everything. And I like that Prof is making steps already. Like she said, there's an app that they are making. So I know that in the next 10 years or so, technology is going to play a very, very big role in medical care, especially in Nigeria too.
Thank you so much. Have a great day. All right. First, what's your name?
Dr. Nusabatunde.
Nice, thank you. So my first question would be, if you were to describe Prof in 3 words, what would they be?
3 words. Well, from what I can remember, I mean, as a student, because she taught me, is she's approachable, a good listener, and a good teacher. A great teacher, by the way. That's 2 words, right? Sorry. Okay. I've said 3 words, right?
Okay. Yes, you've said 3 words. So my next question would be, what significance do you think this lecture will have in the medical field? Or why do you think this lecture is actually necessary?
Okay, by the way, I'm part of a team at the moment. So I kind of understand the signal on this lecture. That's the heart failure of a thing, and particularly the health burden, the cost burden in terms of the spending. So, I mean, if people are aware of the signs and symptoms early enough, they can, once they feel, even though it's not heart failure, I mean, they feel something similar to one of those symptoms, they can present early. I mean, the earlier they present, the lower their classification, and the earlier you can intervene, if at all it's heart failure, and the quicker you can deal with whatever you're managing.
Absolutely. I totally agree. So my final question would be, what major thing would you like to share with the audience that you gain from this lecture?
I've learned a lot from her, but particularly from this lecture, is just the re-emphasizing the significance of actually early diagnosis and management of all these cases, because actually the health burden is a lot, the cost is a lot. So it's just also the significance of early diagnosis and management, basically. That's all.
Absolutely. Thank you so much. Have a great day. Thank you. So yes, early diagnosis, you have to equally check your heart every time so as to know what is going on with your heart. So our next person. Thank you so much. I like the excitement. So what's your name?
My name is Praise Naholu.
Nice to meet you. So my first question would be, if you were to describe Prof in 3 words, what would they be?
Amazing, intelligent. Amazing, intelligent. I don't want to say wonderful. I will say excellent.
Absolutely. I absolutely agree. So my next question is, what message or takeaway did you gain from this lecture?
So during the course of this lecture, she spoke a lot about the heart. So what I picked out specifically is that we need to pay attention to our health, and know that we should always check our vitals or check our systems as often as we can to ensure that we remain in optimum health.
Nice, nice. So my last question, is there anything you would like to say to the professor on this special occasion?
Well, Ma, I would just like to say that you have worked a lot to be here and you deserve everything that you have gotten today and even more. And we, the younger generation of doctors coming after you, we look forward to achieving the things that you have. God bless you, Ma.
Thank you so much. Have a great day. Thank you. So we're still going outside to interview some of the other people. Maybe the guests are still around. Stick with us.
Thank you. My name is Professor Adeola Onokoya. I'm an ophthalmologist, professor of ophthalmology.
Nice. Absolutely amazing. Nice to meet you, Ma. So we just heard from Prof. and she delivered a great, great lecture. If you were to describe Prof in 3 words, what will they be?
One is the erudition, the brilliance, and she's an amazing lady.
I absolutely agree. So my other question would be, what do you think is the significance of this lecture, or what do you think this lecture, or why do you think this lecture is important for the medical field?
Well, it's important because what we usually say is bringing the gown or the town to gown, trying to explain. First, a professor, you have to show people what you're actually professing, the works of your hand, what you have done to humanity. And that is the essence of the inaugural lecture. And she has demonstrated that in her lecture, talking about heart failures, the risk factors, even talking about postpartum, the cardiomyopathy. So it's to educate the public, the populace, about the problems of the heart, because she's a cardiologist, and how we can avoid it such that people would not die needlessly from cardiac failure.
Absolutely. I absolutely agree. So my final question is there anything you would like to say to the professor on this special occasion?
I'd like to say congratulations, Professor Amam Mbakwem. You have done so very well, letting us know that it's important for us to look after our heart, to guard it jealously, particularly against hypertension, which almost 40 to 50% of the population suffer from. Thank you very much, Professor Mbakwem, for that beautiful lecture.
Thank you so much, Ma. Have a great day. Thank you.